Thank you, Ross. I don't have any disclosures. This was presented earlier. A RAND Corporation review that was published in Health Affairs a few years ago analyzed a nationwide insurer's data on the physicians, almost 41,000 physicians, and they found on average a physician spends 50 months or almost 11% of a 40-year career with an unresolved open medical malpractice case. American College of Surgeons did a survey, it was published in 2016, and malpractice cases were reported in almost 25% of its members. And dealing with these malpractice lawsuits were associated independently with increased burnout and psychiatric morbidity, reduced quality of life. You can imagine the burden this puts on an individual who's already in a higher stress environment. They actually did a survey of surgeons who had been in a malpractice suit in the last 2 years, comparing those who had not been in a lawsuit in the last 2 years. And there was a higher feeling of depersonalization, emotional exhaustion, burnout, depression, and even suicidal ideation in those that were involved in a malpractice suit, and a decreased quality of life. Surgeons don't fare as poorly as some of our other subspecialty colleagues, but certainly quality of life is altered when you're involved in a malpractice dispute. In this theory of second victim, and I think in the legal sense, second victim is usually considered the plaintiff's significant other or community of support, but in second victim in terms of healthcare is where you provide care and there's an adverse event, a medical error. You may be subject to a malpractice claim as a result of an injury, and then you yourself become victimized in the sense that you are traumatized for the event, and this lingers on with you. So my advice for surgeons who are involved in this is, one, recognize that you're not alone. This happens to, unfortunately, at least a quarter of surgeons. There will be an emotional and physical toll from being in these events, so don't neglect your physical and mental wellness. And one is get help. If you need help related to those components of quality of life, it's very important to help you get through this so that you don't have stress-related symptoms such as anger, anxiety, depression, physical illness that could actually alter your care of your patients, but also your even your wellness and home life. So I think it's very important. It was outlined by Mr. Goldberg earlier. I think you need to understand the fundamentals of this so that you're getting involved in this. Having basic knowledge will allow you to be more participatory as you work with your attorney and your legal team. And again, a deposition is a sworn out-of-court testimony as part of a civil lawsuit. And these are extremely, extremely important and sometimes the most vital part of a malpractice claim against a physician. So take it very seriously. And the reasons for deposition were highlighted earlier. It's about gaining information, holding the witness accountable to certain testimony. Courts don't like surprises, so they try to get all the facts out in the discovery phase. It also records your testimony for recall if you do have to go to trial. And the other is that to try to give a more contemporaneous or concurrent your understanding of the events, because these things can linger for years and years. This is not a time for you to go into a situation and just try to tell your story. The purpose of the deposition is not only to get the facts of the case, but the plaintiff's attorney is also evaluating you for your how you would be as a witness. How qualified are you? How effective could you be in front of a jury? Probing you for biases, arrogance, or hostility, or something that would decrease your credibility in front of a jury. So it's really your job to be a professional and not go in and say, this is my opportunity to tell my story, so here I am and I'm just going to tell it. First and foremost, in a deposition, you need to tell the truth. You need to be accountable for any actions that occurred and the events that occurred. But it's not a time to guess, speculate, or embellish. If you don't know, say, I don't know. If you don't remember, say, I don't remember. These are acceptable answers. The other is rely on your attorney. There's a reason as a general surgeon I don't do retinal surgery or brain surgery or open heart surgery, and that is because I'm not qualified. I don't have the education, I don't have the training, I wasn't assessed, I don't have the board certification. Your attorney does. Your attorney in all likelihood has been through this on multiple occasions, and rely on them to help guide you through this. Again, your defense attorney and the legal team is your advocate and advisor, and it feels better when you're part of a team than being isolated as an individual. Your attorney can help you prep through this, and there are many things that happen in a deposition that you could get sidetracked without your knowing, such as what is the distinction between a possibility and a probability? What if the plaintiff's attorney mischaracterizes or paraphrases your remarks? How do you handle those situations? The inevitable hypotheticals that occur during a deposition, how do you handle these hypotheticals? Or answering incomplete clinical scenarios. And then the authoritative treatise, and that is, it is published, or so it is written, so it is. And how do you handle the fact that that there may be literature that you have written yourself or that you would quote in a deposition, and how that is actually handled further within the process. Again, it's also important to know the ground rules. What do you do if you don't understand the question? And if you don't understand the question, get clarity of the question. You don't need to answer it if you don't have clarity. You can actually ask for the questions to be clarified. You need to wait until the question is finished before you give your answer, because your attorney who's representing you may object to the question, and you want that opportunity to have that objection before you start answering the question. And it's important to answer verbally. These things are recorded by a court reporter, even if by a videographer. The other is, and this was brought up before, and that is avoid volunteering information beyond the question. It's the plaintiff's responsibility to follow up on any questions that they don't know the answers to. Don't volunteer answers and make their job easier. So that if they need greater explanations or reason or understand more about your opinions, let them ask those questions. Again, listen to the question, be sure you understand the question, think about the answer, express it in the shortest, clearest manner possible. And remember, you can't supply a good answer to an unfinished question. Testifying outside your area of expertise or qualification can discredit you as a witness and show that you may be may be reckless. It's very, very important to maintain a professional demeanor. I've been told in these situations, act like you're going to a job interview. Get a good night's sleep. Don't schedule anything else the rest of the day. Dress professionally. Present yourself in a humble, pleasant manner. You can still be compelling and dignified and show confidence in doing that. But your language, mannerisms, and appearance may not only affect the jury's perception if this goes to trial, but the plaintiff's attorney and that team is assessing you as a qualified witness, and being a professional will only help you. Everybody in the room knows that you know more medical knowledge than everybody else. You don't need to tell everybody that. And remember, the deposition is not the trial, as facts are not being litigated. The deposition is just about getting the facts out. And as was stated earlier, it's the injured patient or his or her team that's representing the patient to prove every element of the case to the required standard of proof. You have nothing to prove, but you do need to be prepared and participate. In summary, be professional, be prepared, be honest. Always remember, it's not personal. It feels personal, but it's not personal. But depositions are usually the most powerful discovery weapon available to the litigator, and so this is kind of the battleground in terms of getting out the facts during discovery. And an effective deposition for a surgeon can have a dramatic impact on the outcome of litigation. Thank you very much.